Hello, everyone, and thank you so much for joining us today for our webinar on technology-based solutions for health and safety in a COVID-19 impacted environment. We're thrilled today to have some amazing speakers, Dr. Clifford Goldsmith, who is the U.S. Chief Medical Officer for Microsoft, as well as our own Suresh Krishnan, who is our CTO here at Mazik Global, and Sarah Camden Howe, who is our Healthcare Product Manager. So a couple of housekeeping items. We do ask that everybody stay on mute just to minimize some background noise. We are recording this webinar, so we will make the recording available after the webinar is completed. And also, if you should have questions throughout, we will be monitoring the chat. So go ahead and type your questions. If it's directly related to something that's being spoken about at the time, I'll do a gentle interruption to the speaker to ask them to address the question. Otherwise, we will hold some of the questions to the end. And with that, it is my pleasure to introduce Dr. Clifford Goldsmith to get our webinar kicked off. Dr. Goldsmith, thank you so much for being with us today.
Thank you, Sue. Thank you for having me. I'm really grateful to Mazik Global and great to be. Thanks very much for muting. So if we could go to the first slide, Sarah, that would be great. We could go to the next slide, my first slide, that would be good. Thanks. So I'm going to talk, and you can pass the slide as well. These slides will be in the deck when you receive them. So if you go to the next slide, I think as Sue said, I'm the US Chief Medical Officer. So let's start by talking about the impact of this pandemic. It goes without saying. In fact, I think we just lost the presentation. Thank you. It goes without saying that this is a historic, impactful pandemic. It's global in nature. There is no place in the world that has not been touched by this pandemic. It ebbs and flows in every country. In fact, we think we know some things about this virus, but we don't know everything about it. We've learned a lot in the last nine months, but we don't know what is driving this virus in the way that it does. We know that it's very, very contagious, and we know that that has been contributed to the speed and the breadth of infection around the world. But we also know there's been speculation that it's somehow related to the flu virus, in that it is seasonal. We are not sure of that yet. In fact, as you look at this map right now, it's summer in the southern hemisphere, but take a look at some of the numbers in the southern hemisphere. Somewhere where I'm from, South Africa, is surging at the moment. So it's clear that we don't know everything about this virus. And the speed at which it spread has actually made it very, very hard for the world to respond in a timely and effective way. What even makes this worse is this is an episode that has happened 103 years since the last significant pandemic. Now, there have been epidemics in the period, most of which have been controlled in the last 103 years. But this is on par or similar to the 1917, 1918 flu or Spanish pandemic. That's not all bad news. The good side of this, so even though we've had difficulty responding and we work out how to respond and to try and lower the impact of the number of deaths, trying to keep our hospitals available to people with COVID that need support. The good side of this vaccine is that the good side of this pandemic is that we have now got a vaccine. In the last 2 days, we've seen it roll out. We have never, ever seen a vaccine produced in the time that this was produced. It took 2 months only to get to the point where we had a candidate vaccine that could begin phase 1 trials. In March, we first saw the virus in January, and by March, scientists had worked out how to do this. This is no coincidence. This is not something that just happened. This is built on generations of research that have led to this point. So we are very fortunate, but we are also very successful as a species, as human beings, to have got to this point that we can produce a vaccine so quickly. We all hope that it has the impact that we expect it's going to have. So if we could go to the next slide. This pandemic has transformed everything in our world. Whether it stays transformed is going to be a question, but right now, It has transformed the way we shop, the way we work, the way we socialize. And we've had to, obviously, to try and limit the number of deaths and illness because of this pandemic, we've had to try and socially distance. And that's led to a new world where everything goes online. We have seen a surge in not just the pandemic, but a surge in shopping online. It's become more and more people shop online today. We've seen ways that we shop, as you can see on the screen here, where senior hours, stores have senior hours. People wear masks outdoors. We've seen people using contactless pickup for takeouts. And it's had the same impact on healthcare. The silver lining in the long run to this pandemic, and we'll talk a lot about this in a few minutes, is going to be that it's accelerated the various areas that are virtualizing healthcare, virtualizing visits, virtualizing business and the way we work, virtualizing the way that clinicians, doctors, and nurses work, and virtualizing remote assistance, which has been one of the most remarkable things. If you're familiar with this, in hospitals and health systems around the world, vendors that have account execs or account reps for their devices or their instruments, let's say like a cardiac catheter, they have somebody who comes to the hospital to be available when a surgeon or a cardiologist is putting in that catheter so that they can help them if they have a problem. That's all been turned into remote as well. It's amazing how much this transformation has taken place. Now, Microsoft is no stranger to transformation. In fact, in our mission, started 6 years ago, we embed transformation as a mission to help every person and every organization on the planet to achieve more. Nothing could be more transformational. And so when it comes to the technologies that we're going to need to support the pandemic and to support the vaccination process, this is a sweet spot for Microsoft. We have created an environment of partners, software vendors like Mazik Global as a key partner of ours in the healthcare space to innovate in the cloud. We have over 68,000 partners across all verticals and industries. But in healthcare specifically, we've been working on solutions for at least the last 8 to 9 years at Microsoft, as is true of many of the other big technology companies as well. But we have brought those technologies together and those solutions together under a single cloud strategy called the Microsoft Cloud for Healthcare. This Microsoft Cloud for Healthcare was announced on October 28th this year, just 3 months ago, just 2 months ago. And Mazik Global was announced as one of the partners that will support and work extending the Microsoft Cloud for Healthcare so that we can deliver a successful outcome to our customers around 3 big areas. And Mazik Global does this. We deliver meaningful patient engagement, we deliver collaboration among care teams, and we're delivering on community connectedness. If we could go to the next slide. I want to reinforce the fact that the changes, the transformation we're seeing are not simply because of the pandemic. I believe the pandemic accelerated changes that were already underway. If you look below, if we go down to the bottom first, you can see, well, let's start at the top line. You can see what the pandemic did. On average, 70% of elective procedures were canceled, and that is starting to happen again in the second surge that we have in the US, but in other countries as well, that's happened as well. This has changed the financial sustainability dynamic for many, many health systems because they relied on these elective procedures. But it also has changed the health profile for people who haven't had mammograms, for people who haven't had colonoscopies, for people with some minor problem that they haven't been wanting to go to the hospital for. We have ahead of us a new world created by the changes that we saw. We also have seen a significant disruption in the financial status of hospitals and health systems, and we've seen layoffs of providers, and we've seen bankruptcy of hospitals. In the US alone, there have been over 50 bankruptcies this year, which is significantly higher for closing of hospitals than they've been in the past. Margins are lower. Everyone's under pressure. Smaller organizations or even some larger ones have thought about or enacted mergers and acquisitions between themselves in order to continue their services as their reserves deplete. And then we've seen the new crisis that we have to deal with is how do we reinvent our health systems? How do we bring in new processes and that ensure quality and the highest quality possible and the best possible care while continuing to work in this new world, a virtual world. And we know that CEOs are struggling with this. But this all is on top of an existing environment that was already strained. Financial sustainability was already a problem for hospitals. We know that they face data breaches. You can see, and we've seen a significant increase actually because of the pandemic in data breaches as well. But you can see $6.2 billion of loss per year in ransomware and other data breaches. We know that patients, as they become better consumers in other industries like retail, have also become consumers of healthcare. They're paying more for their healthcare themselves out of pocket. And so many of them are expressing the kinds of concerns they have for consumer satisfaction that are changing the way that healthcare is delivered. And 41% of providers say that data and analytics challenges and ability to get insights is preventing them from succeeding in bringing in new care models like value-based care models. And ultimately, 14 million people will suffer from, 14 million, there will be a shortage of 14 million people in this industry of both clinicians, primarily nurses and doctors. If we could go to the next slide. That's the basis that we're building on. So when we announced the Microsoft Cloud for Healthcare, we do this so that we can help our partners and our customers deliver on high quality solutions. The first part of why we built the Cloud for Healthcare is that we are is to ensure that we are a trusted partner, empowering our organizations, our healthcare organizations, in a way that they can trust us. We will never compete with our partners. We will never compete with our customers around their data, and we will never monetize our customers' data. We are serious about a true strategic partnership with a win-win on both sides. Secondly, we know that healthcare is moving at a global scale. In fact, the example you're about to see from Mesa Global is actually an example, because they work in the cloud, that is a solution that can be run in any country, and it works at scale. We have over 50 data centers, cloud data centers across the world to meet those needs, and we have a huge amount of reserve in the cloud, in our cloud infrastructure, to help companies achieve more. And then finally, we have for more than 15 years, worked on being secure and compliant, because we realize how important that is to healthcare. Healthcare data is one of the highest valued data from a security point of view. And so making sure that we comply and meet HIPAA requirements and meet GDPR requirements and meet many other industry requirements, especially because of our experience in other industries, we're able to provide this a cloud that can be trusted at scale and secure. If we could go to the next slide. So this is the Microsoft Cloud for Healthcare. I want to say just a few things about this. We've been working towards this for more than 15 years that I know of, and I've been at Microsoft 22 years. We began building many of these assets that you see brought together here many years ago. Give you one example. We built, and some of you may remember this if you're old enough, that Microsoft invested in a personal health record called HealthVault. What that led to, even though that product never made it, as never happened in many of the personal health records across the industry, what was able to be taken from that work were the ability to monitor patients remotely. And so you can see on the slide, one of the solutions is continuous patient monitoring. We've built these solutions and solution areas that are on the outside, the 9 that are on the outside of the circle, to meet 3 big areas. One is better experience for patients and better satisfaction for patients, better care for patients, and improved insights. These will develop further. This is the starting point for Microsoft to introduce the Microsoft Cloud for Healthcare into the industry with partners like Mesa Global. But this will develop. And I can tell you already, in the work that I'm doing and my team are doing together with our product groups, we know that there are many assets that are in the works that will meet many more of these needs. But the goal here is to be able to deliver on an integrated, transformative system, a new healthcare system that can deliver on some of the challenges that we face. At the center of this is the ability to interoperate between all of these areas and make sure that's done in a secure way. So offer common data model that we can really deliver value. So if we could go to the next slide. By way of introduction to handing back to Sue and introducing the next speaker, I'd like to just point out where we are today in the vaccination process specifically, and why the example you're going to see, the Mazik Global Vaccination solution built on the Microsoft Cloud for Healthcare is able to meet the needs of the industry. So in the US, the CDC, and this is true in other countries as well, they're just different priorities. The CDC made priority guidelines or recommendations. And as we saw this week, phase 1 has rolled out. Phase 1 is going to be primarily to health workers and long-term care facility residents. And those are relatively straightforward to get to. And we know where they are and we know how to reach them. And that's why we're seeing no really major holdups yet. But the real issues are going to come when technology is going to need to help us in phases 2 and 3 as we move through different communities, older populations, and then moving into the general population. And some of the things that we're going to have to address are things like, should I get a vaccination? Can I get information on why that would help me understand that I can trust this vaccination? When will I get vaccinated? Why is my friend being vaccinated and I'm not getting vaccinated yet? All of these questions are really important. And in the end, you're also going to need to be able to schedule these on a massive scale across the world, but across the country as well. And you're also going to have to, you're going to have to be able to track who's been vaccinated, because this requires a 2-dose. At least the first 2 vaccines are going to be 2-dose vaccines. So who got the first dose, and can we get them the second dose in the right time and manner so that we don't waste that first dose and that we get the maximum effect of it. So I'm going to hand back to Sue, but this is what Mazik Global have been working on in order to solve this problem and address the problem of vaccination using the Microsoft Cloud for Healthcare. We're very proud to have Mazik Global as one of our lead partners in the Microsoft Cloud for Healthcare. Sue.
Thank you so much, Dr. Goldsmith. Very much appreciate your time and your expertise in this area. I'm thrilled now to introduce Suresh Krishnan. He is our Chief Technology Officer at Mazik Global, and he'll be talking about some of the COVID-19 apps that have been developed to support our health and safety during this time. Suresh, it's all yours.
Thank you, Sue. Hello, everyone. Very nice meeting everyone on this call. I'm excited to be with Dr. Goldsmith and Sarah on this presentation. So I come to you as a Chief Technology Officer of Mazik Global. I spent 25 plus years in healthcare in the provider space as CIO and CTO. Prior to joining Mazik, I was the CTO of Amida Health in the Chicago market, where I had to provide leadership to technology for 19 hospitals and 250 clinics. Part of the issues we dealt with are related to platforms and complexity related to provider space. I will talk a little bit more about that. But at the time I was changing jobs to Mazik Global, I was amazed to find out what a flexible, comprehensive platform Microsoft had developed using Power Platform, and all the cool applications Mazik had developed. So we will get to see a few of those today. And I want to talk a little bit more about my experience as well. So next slide, please. So one of the things you will hear from a provider space is it was always been very episodic care. Patient feel not well, they show up at a provider, either at a physician office or hospital. They get treated, they get better. We took very good care of them and they left and we lost touch with them. And over the last 4 or 5 years, the environment has changed wherein we are trying to take care of patient as a person at the middle of care. So, but most of the EMR platforms in the market, you know many of them, are not designed with the patient at the middle. So this is where a Power Platform kind of a platform, which is centralized around the patient entity, where we can provide additional services around it along the lines of remote monitoring, connected devices, other partner ecosystems, a relationship management with the patient and physician. So we'll talk a little bit more about that as well. Next one, please. So one of the things we saw an opportunity when pandemic hit early 2020. What we realized is the current ecosystem of EMRs are not equipped to handle such a pandemic. Because I was on the provider side when swine flu showed up, and we had to build a completely separate set of systems to manage that pandemic. Luckily, it did not cause the damage COVID-19 is causing, but we were well prepared. This time, same thing, preparing yourself to manage this environment. So initially, what we did was that as the international spreading of this virus happened, we started developing applications to keep this pandemic manageable. One of the areas we did was that initially we started with uh, ability to assess and report symptoms. As an employer, you may want to know how the employees are doing. So we started the symptom checker, and then we quickly moved on to as COVID testing kits may become available. We developed a testing platform using same Power Platform infrastructure to provide an architecture which allows you to do massive scheduling of testing using an open platform. Using that current system of EMRs to do the same thing will require a lot more effort than what you can achieve with the Power Platform environment. And from there, we moved to, as the first wave of COVID got under control, as employers are trying to reopen their offices, as schools are starting to reopen, we built a platform which allowed employees to get back to work safely. And same thing for students, faculty, and staff to get back to teaching and learning safely and quickly. So we created a platform which allowed people to report their symptoms, report their test results, assess their readiness to get back to work, providing green passes. We did that work, and we helped a lot of organizations like Johns Hopkins and Vanderbilt get their students back. And as we moved further along, as the vaccine showed up on the horizon, again, we realized administering the vaccine is a complex process in a health system. As many of you know, flu vaccine and other vaccines have been available. And in case of healthcare, it was made mandatory by many health systems to get a flu vaccine every year, primarily to reduce the risk of losing clinical staff to routine flu issues and staffing issues caused by that. So, and also keeping patients safe. So that flu vaccine, you may or may not believe that a lot of the health system used access databases. I even know a health system which used FoxPro to manage that vaccine process. With the COVID vaccine, we have a little bit more complexity around how do we administer COVID vaccine, because multi-dose and multiple manufacturer. So the complexity of around COVID vaccine management requires you to look at it very differently than the traditional flu vaccine. So we hope to show you that solution we developed. And can you go to the next slide, please? So one other thing I wanted to share with you is that at the last health system I worked at, I had over 700 applications being managed across 14 different data centers used from 270 sites. You know how complex that is to manage. One of the reasons is that each one of those specialty applications had a special need for each department or specific processes, but there has not been a platform where we could develop that. Each vendor picked a different platform, and I ended up holding the support responsibilities. So what I see with the Microsoft Power Platform and Cloud for Healthcare and Magic Solutions is that our ability to build solutions which can be surrounding EMRs, because we are not going to be able to replace EMRs. we can surround EMR with the functionality around patients, relationship management. We built this vaccine administration solution. You can build a virtual health into it, back to work, return to work, transition care management, chronic care management, patient insight. We built models, pre-trained models to handle many of the AI questions you have around patient treatment. So in terms of the platform strategy, what Mazik has embarked on is using Microsoft Power Platform and Dynamics and Cloud for Healthcare as a base for building healthcare specific application. I really miss those kind of application because having to buy a different application for every need, trying to integrate them, trying to connect them from a access control perspective, network connectivity perspective, and data sharing perspective was a complex mess, I would say. And I'm looking forward to continuing to develop more and more solutions. I think I wanted to give more time to look at the product for the team to see. So I'm going to transition over to Sarah for a quick demo of the product, and I will come back to you with to answers if you have questions. Thank you so much for your time. Sue, it's back to you.
Perfect. Thank you so much, Suresh. And as Suresh mentioned, now we're going to get into the demo part of the webinar. And Sarah Kingdom Howe is going to be walking us through some of these solutions. All yours, Sarah.
Hi, everyone. Good talking with you this afternoon. So yes, I am the product manager for Mazik Care's healthcare solutions, and I'm really excited about the common data model and the integrated platform, as we've talked about in this session so far. So I will give you guys an overview of our vaccine product today. And please feel free to put your questions in the chat, and then we'll also come back and address questions at the end as well. So yeah, I just wanted to kind of bring the context back to kind of the vaccine situation we're in, the pandemic. Clifford gave us a great intro and kind of raised some of these questions that are in everyone's minds and that have been consistent themes throughout the pandemic in terms of planning how to do testing and how to go back to work. And now with the vaccine, how to prioritize who should get the vaccine first, how to make sure we're making it equitable and safe and transparent as much as possible. So we're doing, taking kind of this perspective in mind, we're really looking to make sure that what we're offering from a vaccine management perspective is flexible and adaptable to cater to all of the kind of changes that occur as we learn more and more, and also to cater to the different choices that different states or different organizations might make in response to these questions. So our vaccine product is really spanning kind of the end-to-end vaccine distribution and management scenario. So everything from scheduling appointments to managing your inventory, and we're really addressing 3 specific roles here. So we've got the kind of vaccine administrator. So this is where these are individuals who are going to be managing kind of the inventory, requesting it from the CDC or their state and local government, working with the pharmaceutical vendors. And then they're also giving the ability for employees, whether they're healthcare workers or the general public in the later phases, to schedule their appointments, and then of course actually documenting and administering the vaccine at those appointments and being able to report back to the CDC and the state immunization systems. Then we have the employees, so they need to be able to book appointments, whether it's through a call center, whether you're booking them on behalf, or through a self-service portal, and same for patients. So these three roles combined kind of bring in 5 features here. So we've got eligibility and scheduling, and this is this self-facing portal that I'm talking about where patients and employees can go and book their appointments, take eligibility assessments based on whatever phases and eligibility criteria that state or provider is looking to implement. We can report adverse reactions and also, register as a vaccine administrator. Then we have the administration. So this is really about the whole appointment workflow. So once someone's booked an appointment, they're going to get, confirmation messages and kind of the full patient appointment reminders and everything. So we have the ability as well to, through a Canvas app, check in those patients and then fulfill the appointment. So this is an example of the text message. It's got a QR code. It has driving instructions as well as rescheduling links. And you can also customize the messaging in there. It's very flexible and configurable as well. Then from a Canvas app perspective, we're also able to basically search appointments, scan the QR code in to open up that appointment record, and then associate those QR codes or those patient records with the vaccine barcode or serial number. So we can track serial number or batch number, and then that will make sure that in case of any recall scenarios or anything, we know who we've given which vaccine, and we have all of that information tracked. And then we're also, catering for the outcome monitoring as well. So this can entail, symptom reporting from an employee perspective, as well as adverse event reporting. So after an appointment is completed, there will be a SMS URL and email going out to ask them to fill out an adverse reaction assessment. Then the next piece is the inventory management. So this can support 2 scenarios. One, if you are looking to receive inventory from, say, the state or the CDC in terms of inventory. The other is if you're receiving your vaccine inventory to a central supply, and then from there you have to distribute it between all of your different clinics or locations that are actually administering the vaccine. Can use this track and trace capability as well to monitor, where each package or batch number is at any given moment and how long it was in transit, which depots it stopped at, and what temperatures have the containers been that they're in. And that way, if, for example, you go from the chilled temperature to ambient, then there's also workflows in there updating the expiration dates for those batch numbers because the temperature changes have huge impacts on the expiration dates. So all of that is kind of covered on the track and trace and inventory management piece. And then we also have the Public Health Command Center. So this is the kind of model-driven app dashboards that comes from the platform data, as well as more advanced analytics in Power BI on overall population vaccine statistics, like who's been vaccinated, who's eligible, and so forth. So this is kind of the overview, and now let's jump in with this user, Jenny Smith. So she is an employee. We will see how she can make an appointment through this self-service portal. So I will actually pull up the system and we'll walk through this Power App portal here. So you can see it has MazaCare branding right now, but it can be changed to any organization's branding during the configuration process. So there's a number of options here. So we can sign in first if we're an employee. And if we have an Azure AD, we can just sign in with that login. Otherwise, if we're, say, a contractor at a hospital and we don't have an Azure AD account, we can go through the kind of public process in any of these options, whether it's taking the eligibility or finding a provider or making an appointment. So we will schedule an appointment right now. And this is basically our patient registration form. It's going to capture, we've got the basic name, date fields, and we also are capturing all of the information required for COVID reporting specifically. So special accommodations could include things like disability accommodations, as well as translation for different languages. And those are just notes that come in so that the people who are fulfilling the appointment have that advance notice. And the race and ethnicity fields are not typically required in vaccine or immunization systems, but in the case of coronavirus, they have been required fields. So we have those here as well. So then once we've completed all of this information, we'll go ahead and submit this record. And this will now ask which dose we're scheduling for. So you may have patients or employees who get their first dose somewhere else and then come into this system to schedule their second dose. So in that case, if we were scheduling a second dose, we would have to know the manufacturer and the date of the first appointment and all of those details. So that's why this is going to automatically bring up all of this information, which should be on the vaccine card. But for today's purposes, we'll go with a first dose appointment flow. And this will now take us to our eligibility assessment. So these are pre-configured out of the box with the phases from CDC. So phase 1A, healthcare workers, phase 1B, essential workers, and high-risk patients. So these are the 5 questions that you'll see here, but these are completely configurable. So if you want to do different phases, have different eligibility criteria, you're more than welcome to tweak them or completely change them when you configure the system. So here we have kind of the essential workers, and I'm selecting some answers here so that I get into phase 1B or 1A, and that way the appointments will be allowed for me to schedule. So you can also have different phases assigned to different locations as well. Here we now have the consent form. So this can be any consent message that you want, and they're also can be configured by type of vaccine. You can also use this page to record vaccine refusal. This is also something that the CDC wants to track. So if, for example, some of your employees decide they don't want the vaccine, they can actually uncheck this acknowledgement and then submit the form, and that would document their rejection. But if you fill it out, then we're going to be taken to the page with all of the locations. And here you can see the number of appointments that are currently available. So that's based on inventory, appointment availability, and then the patient can use the location and that information to select which place they want to go. And now they can choose whatever time works for them on that day or the next available day. So we have learned a lot of UI lessons from the testing scheduling, and so one of these is definitely making it easy to find the next available appointments, and also to know the appointments that are available that there are appointments available at a location before you even open that location's page. So you're not, clicking through every day and then find there's nothing available and you have to go back to another location and start the whole thing again. So once we select a slot here, now we're just going to submit it and book it. And at this time, a SMS message will be sent, as well as an email confirmation. And these will have the confirmation ID, the date, location, and time of the appointment, as well as the rescheduling link and the Google Maps instructions, driving directions. So this is pretty much the appointment flow, and you could also choose to schedule appointments on behalf of other individuals through the call center. So that includes scheduling for our employee here. Now we're going to switch into the administration of the vaccine. So we can see here some dashboards on our appointment statuses and other things from the model-driven app, and then we have also this administrator role that's going to be using this Canvas app at the clinic. They're going to choose their location, open up the appointment record, and then they will actually document all of the details of the vaccination itself. So we'll walk through both of those scenarios. And first things first, I do want to just show what that confirmation message looks like. So here we can see the text message is what the QR code looks like. Here's all those confirmation details with the time and the driving directions like I was telling you about a minute ago. And then we also have this reschedule link here as well. So these are all unique links for each individual. And if we open this up, it will take us to the same portal that we just looked at, but it will be catered for a mobile web browser with some slightly different UI. So we are able to make sure that it's both web and mobile friendly and friendly across all types of devices as well. So from here, if for some reason patient or employee need to reschedule their appointment, they can also send that request from here as well. And that would allow them to rebook. Now we can move into the Canvas app and complete the appointment workflow here. So upon logging in, the vaccinator is going to pick which location they're at. So here's going to show all of the locations associated with that user's account. So these might be all of the locations within a single health system or within a state, however it is set up. But from there, we can either search locations or select one. And then when we open it up, say Airedale Clinic here, we're going to see all of the appointments that are associated with this specific location according to date as well. So here we can see the confirmation ID, patient, and the date and time, and we can then actually scan the QR code and open up the appointment record through there, as well as through search. So here we have our patient form. So this is all the information entered on the registration page. And we can also update any of this information if anything was wrong or has changed since that appointment was booked. We can flag the comorbidity status. This is a CDC reporting requirement. And then we can change the status to checked in. And we can also input any specific notes, such as the employee is ready for their appointment. And then we can go ahead and submit this. So this will now take the administrator to the screen that has all of the responses from this patient's eligibility assessment. So you can see those same questions. Do you work in healthcare? Are you currently pregnant? Are you over 65? And we have that information at the time of appointment in case any of this is clinically impactful in terms of the actual vaccine or giving the vaccine. Now we will move into actually documenting the vaccination. So here, the main thing is associating this individual with a specific vaccine serial number or batch number, which we will do by scanning the QR code or the barcode. So if it's 2D, we'll just get the serial number or batch number. If it's QR code, we'll also be able to pull in the manufacturer as well. So that is really important in terms of scheduling the second dose and making sure that the second dose is with the same manufacturer as the first dose. And here we need to enter in the dose number which dose it was in the vial. This is also a reporting requirement. And as we've learned from Pfizer and other vendors, these vaccines can have up to 5 to 15 doses in one single vial. So that has to be tracked as well. Then we need to track the route of administration and the site of administration, and then the vaccine status. So at this time of vaccination, if the patient does choose not to get the vaccine, then we can document that it was rejected and then the reason for that rejection, and those are reporting requirements as well. But assuming it all goes through, we'll just say vaccine completed and administered, and then we can go ahead and submit this. And now, since we have now completed a first dose appointment for this vaccine, the patient's COVID immunization status will now update to partial, as it is 1 of 2. And then upon the second dose, it would go to completed if it was within the 21 to 28 day time frame of the first dose. So now we can look at the model-driven app side, or kind of the back-end administration. So first things first, we've got analytics. So here we're going to see number of different dashboards that are configured with all of the data from the platform. And these are to give insights at fingertips of all the important KPIs. So from appointment availability, appointments by location, if we look at our vaccination overview, we've got our patient breakdown by phase, by risk category, the appointment statuses, and for employees, for example, their immunization status, whether it's complete or partial or not started. So we can track all of these things here based on the data we're capturing. And you can also configure them for yourself as a user as well. Then we're tracking all of these different things like providers and manufacturers and vaccine types. So this is where you can actually say for a different type of vaccine, this is the minimum and maximum number of days to get the second dose. And you can also provide a vaccine-specific consent message. We also have the phase set up here, so you can see these CDC phases, phase 1, 2, 3, 1A, 1B, and so forth. And then we have the patients. So both the patients and the employees will have similar profiles, although the employee one also has a work profile. But if we open this up, we'll see all of the kind of registration information. This contacts individual scheduling URLs in case you need to send those on demand at any time. And then their clinical history, so you can see if they were high risk, their immunization status, whether it was complete, not started. That will all be updating based on logic around the appointments. Same with the phase, it can be assigned from the eligibility. And then these are all CDC reporting requirements like vaccine refusal, was a vaccine appointment missed, those types of things. We can record the consent, so these will record anything coming from the portal as well as walk-ins. And if you need to capture insurance information, we also have that capability as well. Then the work profile can be used to set up your departments and the roles of your team members. And then you can use this to make sure that, for example, you don't schedule all of your ICU nurses to get their vaccines on the exact same day. So that's information is helpful from that standpoint. Then we can see all of their assessments and reactions that they've filled out and their vaccination history. So each time they've gotten the vaccine, it will create a record here with the serial number, batch number, and all of that information. And then you can also track that for like recall management scenarios if needed. In terms of generating the appointments, this is really simply done through our appointment generation. So this is where you would basically define the length of appointments, how many stations or simultaneous appointments you can do, and then you would set up your date and time range for this appointment window and how many vaccines you're allocating for that specific period. So you expect about 100 appointments to be done on this day, so you can define that here. And then once you generate the appointments, it'll create the available slots based on all of these different criteria. So that will give you your kind of available windows of appointments. And then the vaccine kits will also be a factor in terms of the available to promise inventory. So we'll track it, whether it's been ordered, and then once it comes on site, we'll enter how many were received. So here you could see we ordered 500 and we received 492. So at that point, the 492 that are on hand, we'll make sure that we have reserved 8 of those as not available now and not received in our inventory. You can also set up wait lists as well in the event that you're out of inventory or out of a promised inventory for a day, that the patient can get a notification once you've added more vaccines. The assessments are also important to cover. So we've got this eligibility assessment. We can see the questions here. This is where we're setting those up, and as well as the phase assignment based on the responses to those questions. We also have another type, the reaction assessment here. So we have, the date the adverse event started, the severity of the reaction, and then we can also trigger a case to have kind of a full case management flow if you want to have that upon the report of an adverse event. So this is really easy to configure. Now, if I go back to my app here, we'll go into the track and trace. So this is, like I talked about earlier, where you can scan all of your vaccine batches into different containers, and then you can track the history of all of the containers and where they have been. And that gives you that full traceability of where all of your inventory is or has been at any given time. And then, like I mentioned earlier, we have these temperature constraints as well, and this can impact the update of the expiration dates for your different batch numbers if any of the conditions change. So yeah, this is basically used in two scenarios, whether you're doing a receiving for a single order or whether you're transferring it within different locations within the same organization. It can be used in both of those scenarios. Now we have our final piece, our command center dashboard. So this is an example of a Power BI report that's leveraging all of the data coming from both sides of the system. You can see our consensus, some of our statuses on eligibility, how many cases have been confirmed, how many recovered cases we have, the breakdown, like a heat map here with the different counties and their immunization statuses, our target populations, how many adverse, like what % are reporting adverse events, all of these different KPIs that could be relevant for the immunization tracking. So this is an example of the kind of power of the Microsoft Analytics and the kind of combined end-to-end platform that's provided by the Microsoft Cloud for Healthcare, which we are leveraging here. So yeah, absolutely taking advantage of all of the different broad capabilities provided by the Microsoft ecosystem. And then we do have an emphasis within our organization on integration into clinical systems, such as Cerner and other electronic medical records. So we can bring all of this into CDS and use that in your reporting and use it in your workflows. We're also working on one with Epic, and I will talk now about kind of the deployment. These are all built to be very quick to deploy. So we really just need your client-provided dev and test environments, and then we can just configure whatever scenarios you might want to tweak. And if you go out of the box, we can deploy it within a few days to a week's time frame. If you make some changes, we're looking at maybe a couple weeks, and we're really trying to get these ready to go quickly because the situation is urgent and we have to be able to use them immediately. We have a whole 60-person task force dedicated to these projects and to the success of the implementations on these products. So we've got Pat Becker, our Chief Strategy Officer. She and as well as Suresh both have over 25 years of experience in as healthcare CIOs and CTOs in large health systems. So they bring a lot of experience from that perspective. And then we have John Bowdler as well, who is our VP of Services. So yeah, this pretty much concludes what I was planning to show today, and we can now move into Q&A. Thank you, everyone.
Thank you, Sarah.
Thank you so much, Sarah. Outstanding information. We did have a couple of questions that were submitted in advance of the webinar, and I don't see any questions that have popped up in the chat. So I think that we'll jump in and ask some of those and ask Suresh, Sarah, Clifford, if you could field them. So one of the questions that was submitted in advance was, how would this work in a festival scenario? Could any of this be tied to a ticketing software that would release the ticket once someone tests negative?
The answer is yes. I think the way we set up a testing scenario for state of Maryland, where they set up 30 different locations with the multiple testing stations in a short notice. As long as we have mobile devices, we can set this up anywhere. And with the hundreds of connectors available with the Power Automate, we can link it up to external systems for ticketing and other status updates. I do not see an issue with this integration with the ticketing system.
Fabulous, fabulous. One of the other questions was how quickly can vaccine flow be deployed? And Sarah, you did touch upon that. Looking at out the box under a week, something longer than that would be something to work out with the team, but it does have a quick speed of deployment because of the way that the solution has been created. And Suresh, I'll let you talk to that a little bit more perhaps too.
Yeah, I think we are providing the solution with the pre-configured questionnaire, pre-configured stations and criteria, facing criteria. So if we go out of the box, we can deploy as early as 3 to 5 days. And if you do additional changes, it may add days to it, but it's a pre-packed, ready to go.
Perfect. We did have a question, Suresh. This one's for you as well. You're up a bat again. It looks like. Need to know if any of the solutions are not supported in Microsoft Gov Cloud.
Yeah, I think right now we are developing it on a Power Platform as is. I think as long as the Power Platform itself is configured for GCC Cloud, and we can build it on top of that. And we will work with partners who are authorized to work in that environment. I do not see any technical issues that will stop us from deploying this.
And the last question that was submitted in advance, and Clifford, this would be one for you, I believe. What has been the most challenging to you as physician and scientific leader during this period?
Interesting question. I think it's been trying to provide accurate scientific information to my team, to our partners and our customers. And I think it's, there's been a tendency to, to grasp onto sensational ideas or things that, and just trying to keep a level, keep things moving forward in a level way. And I think that we're succeeding. So I'm very excited about that.
Yeah. So one thing I wanted to add to my earlier comment was related to in health systems, the biggest struggle is because this came out of nowhere. Configuring the EMR to do testing, EMR to do vaccination, that kind of changes the balance of patient relationship, because these are not patients at this time. Adding them to an EMR really tilts the scale in terms of statistics and other things. So keeping the vaccination and testing data out of EMR and keeping it separate, it makes a lot of sense from a HIPAA and other perspective as well. So that's one more reason to have an independent platform, but integrated so that the data can be shared between the two systems using the connectivity Sarah shared.
And just wanted to ask, are there any questions from any of the attendees on the webinar? Anything that anyone would like added? We will make the deck and the recording available. We'll send out that notification. We're going to have it added to our website, and we'll also notify you when that is there in the next day. And also within the deck, you'll notice that there's also 2 extra slides that have some resources, general resources around CDC recommendations, how the vaccinations are being distributed, the prioritizations that both Sarah, Suresh, and Clifford have all spoken about, as well as access to some of the resources that have been touched upon here. But if anybody has any questions right now, we do have, we're at the top of the hour, but could probably maybe entertain one question or so if anybody has anything. Otherwise, we do have, Sarah, if you advance, do have our contact information, and definitely reach out to us because we'd be more than willing to answer any questions. And I'll also put our email address in the chat here. But, all right, I don't see any hands up. All right, well, thank you all for taking the time out of your day to spend with us. And thank you so very much, Clifford, Suresh, and Sarah, for sharing your expertise and sharing the demo of all of the rules and requirements that are being asked for. So helping to, as we started out, that blend of healthcare expertise with the advances in technology to really get us all back to work, back to school, and back to the lives as we all want to get back to. So thank you all, and everybody enjoy the rest of your day.
Thank you, Sue, and thank you, everybody. Goodbye.
Thanks, everyone. Take care.